All right, let's go ahead and get started. Good afternoon, everyone. My name is Angela Hobson. I use she, her pronouns, and I have the distinct honor of being the Assistant Dean for Public Health at the Brown School. And I also have the distinct honor of facilitating today's panel discussion on our transdisciplinary strengths in public health at the Brown School. We're joined here by a number of our faculty and staff at the Brown School. And what we're going to do today, and students as well, and what we are going to do today is I give a little bit of introduction about what transdisciplinary problem solving is. Then we'll hear from each of our faculty and our current students. And then we have some dedicated time at the end for questions and answers. But at any time you have a question, if you want to pop it in the chat, please feel free to do that. Or you can raise your hand, or you can come off mute and just ask your questions as they come up. And I want to say a giant thank you and welcome to all of our admitted students who are on this call today, and those of you who also watch it later. We are just so super excited for you to be here today and to be considering the Brown School. We're really excited about what the fall is going to bring here for us at the Brown School. So we're just really thankful that you are here and interested in us, and we're really looking forward to connecting with you today and in the future. So with that, I'm going to share my screen, and we've got a few slides that we're going to go through first. And then after we go through some of these slides, I'll take them down so we can have more of a kind of organic discussion about our transdisciplinary problem solving courses. Give me just a minute while I pull up the slides. Okay, everyone see these okay? Some head nods. Okay, great. So again, we're talking about our transdisciplinary strengths in public health. And I think this cartoon kind of sums up a good analogy for public health. So those of you who are not familiar with the saying, howling at the moon, kind of meaning, are we just making a lot of noise and not making much progress? And the caption here is, my question is, are we making an impact? And I think a lot of times in public health, that's what we want to do. That's why we're interested in public health, is because we want to make an impact and we want to improve health outcomes for the populations that we serve. But sometimes it can kind of feel like we're making slow progress, or we're not sure if what we're doing is really effective. Maybe we're just howling at the moon. And that's why we really want to focus on transdisciplinary problem solving, and why we do it at the Brown School is because we know that even if we're classically trained in public health, we can't solve all of the world's, we call them wicked social problems or public health problems just on our own. And we really do need to lean into other disciplines to help us do this work. So some definitions and some context. So transdisciplinary science is a field of research that focuses on distinctive substantive concerns. So again, wicked social problems or complex public health problems are these concerns that we have, and emphasizes particular analytical levels, what we like to call cells to society, and theoretical concepts and methods. And when we talk about transdisciplinary problem solving, we're really talking about multiple disciplines working together to integrate a shared conceptual framework that really draws on discipline-specific theories, concepts, and methods to address a common problem. And I like this graphic here with the Venn diagrams to kind of think about the difference between multi and interdisciplinary and transdisciplinary. And as you can see in the top Venn diagram, biology, social, and economics are coming together to work on a certain policy solution, but the overlap isn't that integrated. In transdisciplinary, we really want to think about these disciplines coming together and having a more integrated, shared conceptual framework to really come up with novel solutions or novel approaches to addressing the problem at hand. And I put this over here. If anyone is a little bit more interested in why we do this well at the Brown School, we can say that our faculty literally did write the book on transdisciplinary public health. So if anyone is really interested in learning a little bit more, that resource is out there as well. So now that I've kind of given a overview of what we think of as transdisciplinary problem solving, I'm going to have each of our faculty panelists introduce themselves and just talk a little bit about the course that they teach. So I think Ellis, you are up first.
Hi, everyone. I am Ellis Ballard. I use he, him pronouns. I am faculty at the Brown School. I'm also the director of the Social System Design Lab, which is one of our research labs here. And the TPS course I teach is called Designing Sustainable Policies and Programs, a System Dynamics Approach. System dynamics is a method that's got its origins in industrial engineering. And part of what is exciting, I'm biased, but is exciting about what we do here at the Brown School is take system dynamics modeling and think about it as a tool for exploring complex, wicked, messy problems like Angela just set up at the beginning. And so Designing Sustainable Policies and Programs is a course on system dynamic simulation modeling where folks dive in teams to develop simulation models to run policy experiments. What might happen if we do X or Y or Z? And this class is always brings together social work, public health, engineering, social policy, and business. We have students in all those classes in this semester's course, but also architecture, anthropology, education, and really we have this sort of merging of teams for this modeling approach, which is really exciting. And I'm happy to chat with people more about this if you're interested. I'll pass it back to you.
Thanks, Ellis. And next is Heather.
Yes, hi, everybody. My name's Heather Cameron. I teach at Brown School in social work and also in this public health class, as well as being attached to the business school teaching social entrepreneurship and innovation. Before joining the Brown School, I ran an international sports for development NGO, and then continue to do work in this space around how do we use physical activity and to increase community safety and to also improve the roles of girls and women in their society. So the class that I teach is based in Berlin, based on my living there for 20 years or so before coming to the US to teach. And we're working with different partners from policy, from like government agencies, to girls and women's programs, to the Senate Department for Urban Development, some of the partners that I've worked with for many years about how they think about public space and how people get access to it, how they are using architecture to design spaces for movement and safety. And yeah, so this is just a great opportunity to sort of see it from the practitioner's point of view, as well as exploring a different policy environment in Germany and understanding how things are also done, in the European Union. And like Ellis, I'm happy to take some questions after we've all introduced ourselves.
Great, thanks so much, Heather. And I think this brings up a good point, and I should also mention to our admitted students is that all MPH students take 2 transdisciplinary problem solving courses when you're at the Brown School. And some of you may picked up on the fact that Heather just said her course is in Berlin. So this is a fun thing about our program is that a lot of our TPS courses are based right here on campus, but then we do have a handful of courses that are distance-based. We are really hoping by the time you all are taking TPS courses in your second year that we will be able to travel again. And those courses are open to everyone. There's an application process, and it's a great learning opportunity and a great experience if you have the ability and want to apply to go on one of those distance-based courses. And Dan, you are up next.
Great, thanks, Angela. And hello, everyone. It's great to see you here virtually. I'm Dan Ferris. I use he, him pronouns. I'm the Assistant Dean for Policy Initiatives at the Brown School, Assistant Professor of Practice. I also lead training and education initiatives at the Social Policy Institute, which is a university-wide institute focused on all things policy. Policy making, advocacy, and analysis in the US legislative system, as we shorthand as the DC course. When you think about wicked, when you think about problems, and we think about wicked problems, I'd be hard pressed to think of other things that come immediately to mind as Washington, DC, and our nation's capital. So with that said, this course is focused on students from a wide range and perspective of policy interests and experience. Students choose a policy topic of interest and specific legislation that's been introduced in Congress. They explore the topic and create content, specifically a policy brief, supported by classmates and a transdisciplinary course team. They meet with national leaders in policy research and advocacy. in advance of meetings with congressional offices about their selected topic. So it's really designed to increase knowledge, skills, network, and efficacy in policy practice, analysis, and beyond. So welcome all questions and conversation about the topic, and passing it back over to Angela.
I think we lost Angela over the internet connection, so I'm going to continue the presentation. Let me share my screen. Sorry about that. Hopefully everyone can see. So now, all right, I think I'm on the right slide, yes. All right, Daryl Hudson, you are up next. If you can introduce yourself and talk a little bit about your course, please.
Sure. Hi, everyone. My name is Daryl Hudson, and it's a pleasure to see everyone virtually, new and old. I hope everyone's doing well and healthy and safe where they're at. And so I'm associate professor of public health and the Brown School. Also have appointments in sociology and in the medical school. So I kind of embody a transdisciplinary person. I'm also the dual degree MSW MPH program faculty chair. So I teach a couple different TPS courses. The one highlighted here, Popular Culture and Public Health, is a course that really tries to tap into other disciplines like film studies and marketing to try to make the things that we sell in public health a little bit more appealing. We have a very difficult sell, as evident by the last year plus of the pandemic. The things that we're trying to sell to the general public are things that are not fun, like wear a mask, stay apart from people that you know and love, don't eat in public, et cetera. So how can we better improve our messaging? How can we, and so pulling in a different lens often helps to do that. So I bring in people from film and media studies and marketing, and we try to have fun with our sobering topics oftentimes. The youth violence prevention course is really about understanding how these fundamental causes, we call them, fuel community youth violence. And so if you think about a city like St. Louis or a city like where I'm from, Detroit, Michigan, there's a lot of factors, and they range from big public policy decisions, economics, and the list goes on and on. So trying to understand and grapple with all these different policies, all these different practices, and trying to figure out a really complex, as mentioned today, wicked problem. So those are a couple courses that I teach in the TPS realm, and happy to entertain questions at the end.
Thank you. Now we're going to move on to Rodrigo.
And I am back. I'm so sorry. I'm in my office at work, and all of a sudden the internet went out. And so I think, like with everything with COVID and Zoom, it's been a giant exercise in flexibility. So thank you, Makia, for taking over. And I hope I don't get kicked out again.
I'm glad you're back, Angela. Hello all, my name is Rodrigo Reis. I am professor of public health. I teach built environment in public health, also associate dean for public health. So I listed the three of the things that I think are part of the uniqueness of the course that I teach, but I would like to bring you the attention to other points. So first, this course really speaks to the intersection between transportation, planning, and design, what we like to call urban systems, and public health. So it's really hard for you to really work together with folks that are coming from different disciplines. So the question that I always ask myself, and that's what I like to discuss with some of the students. I have one of them here. I can see Qais here. So when we are working with different disciplines, there are two basic assumptions that I think we have always to make. One, it's not about what you want, it's about what you can bring on board. And second, what are the common elements you can find to work together? So obviously we want to advance population health and well-being, but working together, I think, is the critical part. So to me, our course is really, we try to learn methods and language and a basic understanding on how public health could be embedded in different urban systems and how the different urban systems really connect to public health as well. At the ending, we want to provide solutions and translate findings to be implemented in those different systems. In our case, we use a tool that is called Health Impact Assessment, which provides sort of foundations and also evidence that it's easier to translate to known health audiences. In our case, transportation engineers, planners, designers, and other people working in different disciplines. That's in a nutshell what I have to say, but I'll be happy to take in more questions, or maybe Qais, you can provide those questions, those answers, because you know that already.
Great, thank you, Rodrigo. And Deborah, last but not least for faculty is Deborah.
Yeah, hi, thanks. So I'm excited. We'll be teaching a new TPS course in the fall. So we haven't taught it here at the Brown School. I taught something similar in the University of Texas where I was before. So it's called Health and Place, Spatial Thinking and Applied Methods. And the point of this course is first to learn all the principles of spatial thinking, spatial epidemiology, and health geography as conceptual frameworks that bring together sort of a way of approaching public health problems of all types through a transdisciplinary lens. So when you use spatial thinking and its methodologies, which do involve things like geographic information systems, which is what everybody defaults to when you're talking about spatial analyses for public health or for social work. It involves that, but it involves many other tools. When you use a spatial thinking approach and these sorts of tools for public health, you're inherently going to have to be dealing, whether you know it or not, with working across disciplines. And we're going to make it very explicit through this course, all the transdisciplinary learning. Why? Because the data sources that you use for using spatial thinking and spatial analyses will come from different sectors, whether you like it or not. Usually it's not public health that collects and harnesses spatial data. We take that from other sources. So we're going to be learning how to think like geographers, how to think like urban designers, how to think like people that do nature and conservancy, among many, many other disciplines, economists, etc., that harness spatial data. And this is a very applied course. So don't think that this is actually sort of a traditional methods course. You will learn through this course, if you enroll in it, a series of sort of different tools available when you're trying to answer questions using a spatial thinking approach, questions that relate to health and place. So what I say here is that we take a place-based approach for solving complex public health problems. And throughout the course, we will have guest speakers from different disciplines to help us give examples of how they use spatial thinkings and different types of methods to solve problems within their own disciplines. And what I like to do here is bring people that not are necessarily researchers or scientists, but people that are doing hands-on work and making everyday decisions that impact our lives in a direct or indirect way. So that work in different departments of cities or urban departments too, using spatial data and making spatial thinking decisions every day that impact public health. So I'm excited about teaching this new course here. Hope some of you, I get to meet many of you throughout the process and hope you enjoy it.
Great, thank you so much, Deborah. And we also have 3 current students joining us today, and I'd like for each of them to introduce themselves, and if you could tell everybody the TPS courses that you took during your time here, that'd be great. Sarah, do you want to start us off?
Sure. Hi, I'm Sarah. I use she, her pronouns. Um, Everyone froze for a second there, so I don't know if you caught that, but I'm Sarah. I use she, her pronouns. I'm a second year MPH student, and I'm specializing in health policy analysis. And the two courses I took were the DC course with Dan Ferris and Deborah Hare Joshu's obesity and public policy. There are a lot more words in that title than just those three. I can't remember all of it, but I took those two.
Great, thank you. And Q, would you go next?
My name is Q. I'm a second year MPH student specializing in epidemiology and biostatistics. My pronouns are he, him. I was in two classes, one with Ellis for system dynamics and with Rodrigo for the built environment.
Great, thank you so much. And Maria.
Hi everyone, my name is Maria. I am a third year doctoral student, and I've taken the course with Dan Ferris, and I've also taken child maltreatment prevention with Brett and Melissa.
Great, thanks so much. So all three of you have taken a course with Ellis. Is that what I heard? That's pretty, oh no, Sarah did not. Okay, nope, got that wrong. 2 out of 3 though, not too bad. Okay, so I have some questions for our faculty about the courses in particular, and some questions for our students too. And then we'll open it up for admitted students to ask some questions. But I think one thing that students are always kind of interested in is, okay, so you kind of give an overview of the course, but could you talk about maybe some specific assignments or assessments that you do in your course? I mean, obviously these are not the types of courses that just have an exam. So what kind of assessments do you look for in graduate students that really integrate the TPS? And what kinds of other things do you do in your course? Do you have field trips, guest speakers, that kind of thing? So anybody, I'll just, whoever wants to jump in first, that'd be great. Heather, please.
Oh, good.
Okay, well, basically, our entire class is a field trip in that we are visiting all sorts of different sites in Berlin, the capital of Germany. And we go to the Bundestag, which is like Congress, basically, and meet there with a member of the Bundestag who we've worked with for a long time, who's a policymaker. She also sits on the finance committee, and talk about investments in infrastructure in general, but also around sports infrastructure for refugees, infrastructure for women and girls. And so you get a chance to sort of get the policy angle. Then we visit with different sexual health clinics. Of course, the healthcare system in Germany is very different, but they have free clinics, which are often used by the undocumented population or also sex workers and so on. And since we're looking at gender, then we have the opportunity to go to some of these clinics and see how healthcare is provided. And then we also have opportunities to visit with different sports clubs and physical activity clubs, as well as with some of the people who we're hearing also from Rodrigo and others about spatial design. And so we're talking to people with the Berlin, who are responsible for the Berlin city urban development, and talking about bike lanes, or talking about lighting, or talking about access to sports facilities. And so all of these visits are then, we work with German students who are also there working in social work and public health, and then have the opportunity to discuss, with people who are learning or practicing, in Germany, and to get that sort of experience in terms of what do we value in the United States, how do they do it differently in Germany, what can we learn from that. And then the sort of assignments we would do, Angela, often are about working together with one of our longstanding partners from the NGO work that I've been doing in Berlin for 20 years. So with the Girls Sports Club, thinking about kind of how to improve the way they talk to children about migration, or working with another organizations which is trying to find a way to measure the impact of the interventions that they're doing at their school. So we basically have the students working in teams with one of these German partners. And then over the 2 weeks that we're there, of course, it can't be a huge intervention, but an opportunity to learn from colleagues in another country, with students from another country, and then reflect a bit on what that means for the practice that they have in America.
Great, thanks so much. And I think somebody put in the chat, was that you, Rodrigo, that you'd like to come back to school and take all these classes? And that's kind of what I'm getting from this too. I'm like, gosh, I want want to go to Berlin next time.
That's how I feel every time my colleagues speak about the course they teach.
Yeah.
Dang, how come I'm not doing this again?
Yes, exactly. All right, who else? Who wants to answer this? Daryl, were you about to answer too about kind of the activities and assessments that you have in the course?
Yeah, I was, and I'll try to be brief. So I think some of the things we do is during non-pandemic times, we would go to the local NPR station to figure out how news is made. And so I think that's really important for understanding how the media covers news, especially in this particular environment. What is eye-catching to a person in the media? That's something we don't oftentimes think about enough in public health, how to sell that story. Some deliverables that students work on are op-ed, so how to, write something that is going to catch the eye of the general public. We also do kind of like media analysis, so we'll do a content analysis of different movies and things like that, which is very outside the box of what I've ever done in public health. But I think it's important to think critically about the media that we consume. So those are some of the things that we do.
Great, thank you.
Yeah, and then in the case of my course, I mean, obviously it's a new course, so I can't say we've done it yet, but the plan is that students, since day one, we will identify groups and where we want to find, based on students' interests and past training and experience, we're going to try to identify the highest contrast with other classmates to put together small groups, and throughout the entire semester, each group will be assigned a topic, a transdisciplinary problem, complex problem in public health, that they will have to first diagnose and then address, proposing some solutions using spatial thinking as the central element, and a series of tools to do spatial analyses throughout the course for that specific sort of wicked problem.
Great, thanks so much. Anyone else want to jump in and talk about the assessments and activities in their course? Ellis or Rodrigo?
Yeah, I briefly mentioned that before. Now, our main product is a health impact assessment, and we do a lot of in-class sort of work. So we work in class with students in smaller groups, and we interact to slowly go through the different stages. We also have sort of an emphasis on real world scenarios. So the health impact assessment has to be conducted in a policy, program, or project that is being discussed or is about to be implemented anywhere in the world. So we always have some interesting ideas. We have people doing work in different countries, or in St. Louis, or in different parts of the nation. That could be a wide range of projects, policies, and programs. We see in a hospital that has been redesigned, or a whole neighborhood that has been proposed to be changed, both zoning and transit, public transit, for instance. And again, remembering that this is a built environment related project. So I think that's the way we sort of implement a lot of the concepts and the methods we learn is through the health impact assessment, the main product.
Great, thank you.
And in the system dynamics courses, all the courses we teach are co-taught, and it's a sort of a design where there's faculty, but then people who are practitioners using system dynamics in their work who are teaching it together with us. So that means that we can bring in examples of practitioners who are making that translation of work from the classroom to practice, who are part of that team. So this semester we've got, my co-instructor works in K-12 education advocacy here in St. Louis. We've had folks who are alums and non-alums who talk about work with the Federal Reserve Bank, work in community development in India. We've got a presenter coming up in a couple of weeks who's a system dynamics modeler in Bogota, talking about some of her work on the digital divide, using system dynamics modeling with some national level coalitions. And I think this is a really nice mirror of how the course is developed, where folks are doing skill building for the first part of the semester, and then really diving deep, kind of analogous to how Deborah's describing her course. We're saying, how do we look into a specific problem domain that cuts across traditional public health or social policy boundaries, and then advance a solution through the application of system dynamics methods. And I think what's really exciting, and I know it's true for our course, but I expect it's true for many of my colleagues, that these are anchored in work folks are doing as well as research assistants with practicum. So it's not sort of it ends at the end of the semester. Often for my courses, people take this along and then bring it into their practicum work as well, which I think is a really exciting approach.
I think if I may jump in just to say something that, it's quite interesting to see when we see our colleagues talking about their courses and how much synergy there are between courses, because Ellis, systems thinking, Deborah's spatial thinking, what do we do in our class, what Darrell is doing for social determinants of health and health equity and communication, and real practice, experience that Heather is doing. So there's a quite synergic, I would say, approach that you see a lot of the elements in one course that sort of connects to the other course. So if you can design your experience in a way to frame your main interests, it could be towards health equity or systems thinking or EPI or urban design. I think to me that's what excites me about quite a bit about our program and makes me want to go back to school.
Great, thank you, Rodrigo. And Dan, I don't want to leave you out. Do you have any additional thoughts on?
No, thank you though. I gave the playbook for the DC course when I introduced it. So happy to jump in on the next one.
Okay, sounds good. So I see a few questions in the chat, so we'll make sure that those are addressed, and then I'll transition to asking our students some questions. But I see Julia asked if you have to be a dual degree or just MPH, and Q, thank you for answering that, and that's true. All MPH students, whether you're a dual degree student, a joint degree student, or a solely MPH student, you're required to take the 2 TPS courses, and then those courses are open to all of our other degrees too. So social work and social policy students are in those courses as well, as Sarah mentioned in her reply. And then Victoria, I see your question. You say, are students able to take more than 2 TPS courses? And yes, so the 2 is the required minimum. But then depending on your specialization, you may take a TPS course as a fulfillment of your specialization. And then all MPH students have an MPH elective that you have to fulfill. And that could be an additional TPS course. And then depending on if you're an MPH student and not a dual or joint degree, you typically have some room in your final semester to take some additional courses within your credit cap. So that could also be a TPS course. So if you planned it right, you could probably come out of here with 4 TPS courses if that was something that you were really interested in. And of course, we have a great academic advising system here. So you work closely with your academic advisor to plan that out and make sure that you're meeting all of your specialization and degree requirements with those. So I'm going to turn, and please, if there are other questions, please put them in the chat and we will answer more later as well. But now I'm going to turn back to Maria and Sarah and Q, and I just want to ask you talked about the 2 courses that you took. I'm wondering if you could let our admitted students kind of know what were some of the key takeaways from the courses that you took, or what did you really kind of get from it and learn, and how maybe it expanded on foundations courses and how you built on that knowledge base over time through those courses. Those are kind of a loaded question, kind of multiple part, but I think you get the gist of what I'm asking there.
Like one thing that I really enjoy in Ellis class, that we have like a group presentation every week where we're using models basically from topics from the news. So it's called model news, and it's kind of interesting because you're seeing these models being implemented in different topics from different fields, not necessarily health related. So it's kind of interesting to know what practices you can implement it in and how you can implement it and how different people think when it comes to system dynamics. So it's something I really appreciate. With Rodrigo's class, we also have this global understanding of the environment that we live around us. We had speakers coming from the UK, from Ireland, I believe, people coming from Korea, from all over the world, sharing with us their neighborhoods, how they're structured, and how that environment affects you and your health in a sense. So it just illuminates you in a sense, like in terms of knowledge, yeah.
Great, yeah, thank you. Sarah or Maria?
I can go first. I think we were playing like chicken in a
Right.
way. Yeah, so I came to the Brown School knowing that I wanted to work in health policy. And so most of my specialization courses were all in like health policy and how to analyze policy. But the two TPS courses I took kind of retransformed my idea of what policy means when you're engaging with actual policymakers, not just taking data and analyzing and recommending policy, but how are you actually going to talk to them? Because that's an important part of like translating the data. And so definitely Dan Ferris's course, we were all being trained on connecting with organizations in the DC area, connecting with federal legislators who could advance a policy area of our interest. And we were all set to go. And then the pandemic happened. But it was cool because then you learn how to think really on your toes, because we all transitioned within like 3 days to a virtual model and learned how to like ask them if they would be flexible enough to call us instead. And could we set up a Zoom meeting with them? And generally, I think we had like 6 legislators in our docket and we managed to contact 4 successfully. And so that was pretty exciting. And so it was really a lesson in like, how do you spin as fast as possible, because the world of policy is slow and fast at the same time. How do you talk to them, and how do you use your knowledge and all of the foundation courses you're learning in public health and craft an effective message in that angle.
Great, thank you.
For me, one thing I realized I forgot to mention is like what I specialize. So more broadly, my area falls under like child maltreatment epidemiology and child welfare policy. And so the great thing is like as Rodrigo was saying, like the synergy between courses. And so I took child maltreatment prevention. And one thing I also forgot to mention was that as a doctoral student, I was fortunate to take both courses and also serve as a teaching assistant. So I was able to see kind of the courses from both ends. And so the great thing about the child maltreatment prevention course was that we had guest speakers from all different disciplines, policy, medicine, public health, and social work, really talking about how we can design policies, but also solutions to prevent child maltreatment. And so that was nice. We had to develop do a policy analysis of different state policies for child maltreatment. And then we also worked with a community organization to develop a product that met their needs and further their goal of child maltreatment prevention. And then for the policy course that Sarah also took, that was really great because, we did have that wonderful experience of like learning how to engage with legislators. We had, people from different disciplines, political scientists, policy analysts, and just it was really fantastic to be able to learn from those different perspectives. I think it really drives home the value of transdisciplinary work in addressing these really challenging problems. And so I really just enjoyed the courses, and transdisciplinary research and work is really key to creative solutions for difficult problems. And I think both classes, and I'm sure everyone can speak to their classes, do the same.
Great, thank you so much. And I'll transition back. I've got another question for our faculty. I know a lot of the students here are the admitted students. You're making decisions about where you're going to land in the fall. And of course, we would love it if you landed here at the Brown School, but we know you have some important decisions to make. And I think, no matter where you go, public health wins, and that's what we want. We need highly trained, highly competent workforce in public health, and that's what you all are going to be in just a really short amount of time, no matter where you go. But we know you're making decisions, and so for our faculty, I'm wondering if you could give us some thoughts about why you think we do transdisciplinary problem solving or transdisciplinary thinking so well here at the Brown School. Maybe what distinguishes us from other places. We have these courses, of course, but what else is special or distinct about the Brown School in this regard, or other regards as well?
Well,
I can jump in. Oh,
Yeah.
sorry, go ahead, Rodrigo.
No, you first. I'm sorry. I think I'm too excited with this session.
Okay.
No, Angela got me going here. So sorry, Deborah. Go ahead.
No, I'll just say one thing and then, sorry, my dog is in the background. I think to me as faculty, I'll tell you what attracted me to come here, definitely to work with very talented students, but the focus on actual impact, sort of Angela's first slide with the wolves howling at the moon. I do see here that our focus when teaching and when doing research at the Brown School is that we really want to answer the questions that are not just interesting or easier to answer, but the ones that if we get there, we will hopefully be benefiting public health. So focus on impact and focus on equity. We have a very explicit focus on reducing health disparities and achieving equity that I think personally it very much aligns with my sort of philosophy, and you'll see that throughout your courses, certainly with the TPS courses. And that's why we have the TPS courses, because to do real world impact, it's not just going to come, the answers won't come from a single discipline. And I think we understand that very well in our program. So I think it's a strength that we have.
Great, thanks so much, Deborah.
There's not much left to say after Deborah.
Yeah, she did sum it up nicely.
Yeah. Oh, Dan, you should go ahead because you didn't say anything before.
Thanks, Daryl. I was going to say the same thing to you, but I'll jump in. What really stands out to me, and Deborah, I really appreciate the way that you framed it with kind of what brought you to the Brown School also. What brought me to the Brown School was, that it's truly a unique and special place, and that there's public health, social work, and social policy graduate programs all under the same roof, virtually or physically. And then I also think about, as I look around and remembering my colleagues' introductions, that even extending outwards beyond those kind of three core domains and fields, the partnerships that my colleagues in these rectangles have with the business school and with sociology, the law school, and kind of really the med school, really looking across campus, I think is really, really built into the fabric of the Brown School, and is one of the great strengths that lead to that impact, focus on impact and ability there, as Deborah mentioned. I'll turn things over to Daryl.
Yeah, sure. I would say two things that are unique about the Brown School relative to other places that I've been and experienced. One is people are really nice here. So I think the faculty and the students are genuinely really generous and really vested in student development. Going along with that, I think the structure, I won't go into the weeds of funding and how our faculty are funded and what happens at your traditional school of public health, but where our incentives are aligned with our mission. And so I think that a lot of places talk the talk, and they emphasize transdisciplinary thinking, they emphasize equity, et cetera. But if you look under the hood, it's not really structured in a way that makes it possible for you to do that. It's very siloed. We don't even have departments in the Brown School, so I think that helps a lot. I have offices, my office is next door when we're in the office, to people in social work, and not just social work, but policy and people who have backgrounds in economics, sociology, anthropology, et cetera. So I think those are two unique things that set the Brown School apart in my estimation. So I'll stop there.
Yeah, thanks so much.
I think the only thing I would add, because I would echo a lot of what other folks have said, but is I think Daryl setting up about the idea of the incentives aligned to support the ideals that we're talking about. One of the manifestations of that is opportunities to dive deeper, so that the classes are not sort of the end point, that you learned what you did and then good luck. Really, this is like an avenue to diving deeper into collaborations, research assistant jobs, practicums. In St. Louis, I'm not from here, but part of what's exciting about St. Louis is a lot of people who graduate stay. And so there's also a network of folks who are trained in public health, who are then thinking about how do I feed this back in. So there's long-term relationships within the city. So that it's not just a classroom, it's classroom.
Great, thank you. And in interest of time, this is going an hour that's going by very quickly. I want to open it up to our admitted students. If you have questions for our current students or our faculty, please take yourself off mute and ask, or put it in the chat. Any questions from our admitted students that are attending? No one wants to be the first one. Okay, here's one in the chat. Thanks, Madison. So for the TPS courses that are offered outside of St. Louis, what kind of costs are associated? Is the student responsible for covering travel and housing costs, or is that covered in the course fees? So I don't want to get myself in a whole lot of trouble here. So if anybody wants to jump in here to help answer this too, that'd be great. But we do have funds. Heather, yeah, do you want to go ahead and, since you are, yeah, that'd be great.
Sure. Well, again, maybe I can start and you can fill any gaps. Through some generous donations, the Brown School also has a global programs office, and they generally make 3 subsidized courses available, not just TPS, but also just outside of the United States, or generally, I guess, outside of St. Louis courses available, one of them being in Germany. And so what's happened in the past is that students have only been required to pay an extra $1,000 in addition to whatever course fees to cover all the travel and accommodation and other costs that are there. So basically you pay $1,000 and your fees for food, and you're in Berlin for 2 weeks, including your flight and your accommodation. I think it might be possible it goes to 1,500, but it's still like less than half the actual cost. So I'm hoping that will continue afterwards, but as we know with COVID, nothing's that clear, but I know our dean is very committed to creating international opportunities for our students. So we might not have as many classes, but generally the rule until now is that students have paid 1,000 or 1,500 to travel, including to places like Tanzania and other places in Africa. I'm just one representative of people who are teaching courses outside of the country. And so then you would apply, and then the instructor picks 15 people based on interviews or based on, again, who needs what class. And then those students are able to have the subsidized trip.
Thanks, Heather. And how that works is typically those courses, like Dan's DC course has traveled to DC over spring break. And then the other travel TPS courses are typically towards the end of May after spring semester is over. And then that's when you travel as well, Heather, to Berlin, is in May or June? Or is that a?
Yeah.
Okay.
Yeah, we do it usually at the end of May so that students who have summer internships back in the States can start. And I've usually also offered 2 summer internships with my company in Berlin over the summer for MPH or MSW students. And they've seemed to have really enjoyed the opportunity to continue working in Berlin with public health partners here.
Great, yeah. And maybe, Kathleen, I see your question, but I think Heather's answer kind of transitions well into Victoria's question about how students have become engaged in research with faculty stemming from their TPS courses, or how do professors integrate their own research into these courses. So, Heather just talked about, students doing practicum there, but could anybody else talk about how maybe students have gotten involved in research from these courses, or how you integrate your own research into the courses?
I can start out and answer Kathleen's question maybe at the same time.
Okay.
So for our work in the system dynamics, we have sort of a coursework, but then it's tied to the work of a research lab. And I know a lot of my colleagues have similar type of associations, so that there's opportunities to have research assistant positions where folks will dive in and work on some of our ongoing work. So one of the projects that I have going on that I have system dynamics students working on right now, that Maria is actually involved in, is around child maltreatment, and a national network of researchers doing work to address child maltreatment. And so we've been doing some system dynamics work for developing research agendas as a piece of this much larger center that's led by Dr. Melissa Johnson-Reed, where there's opportunities to get involved in that work for folks who want to dive deeper when there's substantive alignment. And then I'm thinking just in terms of what we mean by the scale of wicked problems, the way I use the term, I'm curious how, Deborah, you would frame it, that wicked can mean anything in terms of scale. You could have a wicked problem that's unique to an organization around organizational sustainability that's working, community organizers in St. Louis, but it also can be multinational. One of the projects that we're working on now that we bring into the system dynamics courses is around regional strategy around malaria elimination in Mesoamerica, which is, multinational, huge numbers of people who are impacted, and the commonality is the frameworks and the tools that we work on, rather than it being designated to a specific scale. But I'm curious if other folks have thoughts.
I'll jump in since I think I used that term too, the wicked problems. Yeah, I personally within spatial thinking and spatial analysis of place-based public health, we also don't necessarily define it by a scale, so pretty much aligned with Ellis's answer. The problem in itself, it's what's wicked or very complex because of the nature of so many sort of disciplines or priorities building into the same thing and doing sort of like the perfect storm. So I define it more of like, right now we have a problem because we have the perfect storm of things that put it together, whether it's in a neighborhood, which would be the smallest scale that I would look at when thinking of place-based public health, or in an entire city or in an entire country or in the world. And we will look at those examples at different scales within my course for sure. Something that I didn't get into, but in my course we'll definitely be looking at a lot of international or global multi-country types of examples and what you do for comparing results and whatnot that are place-based in nature, space-based. So definitely a lot of opportunities for that. And personally, even if I haven't taught this TPS course here, but in my own coursework, which also includes other non-TPS courses, I always draw from my own research and what I'm currently doing and working on within my lectures, examples, exercises, etc. I think it's an easier way to bring down sometimes complex concepts to practice and to the application side. So I always do that. And I've seen with other courses that are not even TPS, a lot of really good tie-in with students coming to me after, and I open it up. I'm very explicit about it. I take practicum students, I advise capstone students, and even if, if you're interested in research assistant positions, I usually have some ongoing projects, and I'm always open to that and lay that out during class to do these connections. So I've had a lot of experience with my students and other courses being involved with my own research in different capacities.
I think a quick reaction to Victoria's question there. Victoria, no, several of us, not to say all of us, work with students as RAs. We have different projects. Those are paid positions most of the time. We also have volunteer positions. So there are plenty of opportunities to work. And obviously, each one of us, we focus our work in our expertise, and we teach our expertise. So it's really hard to disentangle our research experience to what we teach, because we teach what we either practice or research. And it's not only research, it's practice as well. We have professors who have practiced, they're really experts in real world solutions, and they're actually doing real world problem solving now. It's not only I would say research per se, but applied learning experience, I would say.
Excellent, thank you so much. And we just have a couple of minutes left. Are there any last questions from our admitted students who are attending? Let's see, Amalia says, could any faculty members or students speak to their experiences or views on mentor-mentee relationships at the Brown School? Any advice or observations for incoming students on building those kinds of relationships? Why don't we ask our students that, if you have some advice on how to build relationships with your faculty?
I can add some. I think for me, it's because I'm a doctoral student, it's a little like embedded as part of the program, but I have built a lot of relationships with other faculty just through classes or through shared interests. interest where like maybe I take a class and they have opportunities and kind of like Deborah was talking about, they open up the opportunity and it's a great fit. And so there's so many opportunities, and I found that the faculty are typically very open to just taking in students and helping them grow.
Thank you.
I would say like, just be yourself in the classroom. Ask questions, show interest, be engaged with the professors. Ask questions, seek help if you need it. That's the best way to build connections with your mentors. And yeah, they have an open door policy most of the time. Just show up and they'll receive you. Yeah.
Thank you.
I guess just to add, like professors are also willing to talk about like anything in your life, really. Although their expertise is in public health, social policy, or in social work, their interests and their expertise in like other life things extend so far. Like I have an ongoing email thread with one of my professors where we just trade cat photos, and so it's really about anything.
That's great. Thanks so much. And yeah, just in this last minute, I will say that too. I think I can speak for all of our faculty that are here and beyond that. We want you to be in relationship with us. We are just ordinary, regular people, and we are nice. Like I think it was Dan who said that, or Darrell who said that we're nice. We generally are very nice, friendly people. So don't hesitate to reach out to us. You know, I think sometimes students hesitate to do that, or they're not sure if they should. And I'm here to tell you, you absolutely should. And just reach out to us with questions or concerns, or just to say hi and to get to know us, because we love that about our students and really value those relationships with our students. Okay, well, we are like right at time here. So with that, I just want to thank everyone here so much, especially the admitted students who have come and taken an hour out of your day to learn a little bit more about us. I hope you enjoy the rest of our events for Admitted Students Week, and thank you so much to Admissions and Recruitment for hosting all of these really wonderful events. And thanks to our current students and faculty who came to this. And again, we hope to connect with all of you again in the very near future, and just reach out if you have any questions. Thanks so much.
Thank you for hosting. Bye.
Yeah, this was
Thank you.
really great. The best Zoom I have today so far.
Me too.
See you
Bye.
guys in the fall.
Thank you.
Hope so, yeah.
Let's go.